Imagine a patient sitting in the chair saying, "These folds were already treated," and they came back again. Familiar? I hear it very often during consultations. In this episode, I'll show you a different way of looking at nasolabial folds. Not as lines to fill, but as a symptom of skin quality and tissue support. Work with the patient you'll see here began 2 years earlier. She already had PDO threads placed back then, which I'll talk about in episode 3 as a continuation of the therapy. Now she has returned with the same concern. So let's start with a key question. Why do nasolabial folds so often return, even though they've already been filled? The nasolabial fold doesn't appear for a single reason. It's the result of overlapping changes in several layers. Imaging studies, including Gioloff in 2021, clearly show downward migration of fat pads, which deepens the shadow and the fold. Second, reduced skin elasticity. With age, fibroblasts lose the ability to synthesize collagen and elastin, and UV radiation further degrades elastic fibers. The third mechanism is overload of the mimetic muscles. Constant work of the muscles lifting the upper lip turns a dynamic groove into a static one over time. The fourth element, bone resorption. With age, the maxilla loses volume and support, which, as described by Mendelsohn and Wong in 2021, increases the contrast between the midface and the lower face. And finally, disturbance in the relationship between superficial and deep fat. When that boundary becomes blurred, the light reflects unevenly, clinically visible as the shadow of the fold. This is why the fold isn't a single structure, but a whole sequence of changes requiring precise, layer-by-layer diagnosis. We're about to go through the full procedure with strong focus on details, but first I encourage you to take a look at the patient's diagnostic chart, which you have filled out in the downloadable materials. I've also prepared a reminder of the detailed vascularization of the fold area for you. I recommend reviewing this file so you can approach your treatment work even more precisely. You can now see 3 photos. The top one is from 2023 and shows the patient before her very first nasolabial fold treatment. At that time, I applied PDO jamba threads. You'll learn more about that part of the story in episode 3. The middle photo was taken in 2025, when the patient came back asking once again to improve this area. Despite the time that passed, the folds are clearly shallower than they were in 2023. The bottom image shows the healed result a few months after a combined treatment, hyaluronic acid and PDO jamba threads. Now it's time for the key element, performing the procedure itself. Preparation and treatment planning are crucial parts of the whole process. They build safety, precision, and full control over product placement. In this section, I'll present everything in a structured way and show each step on video to clearly illustrate the correct working technique. I always start the treatment with anesthesia and disinfection. If you enjoy this content and would like to watch the full episode, register for free on VOD Vismed Online and get monthly access to the latest knowledge based on research and real clinical work with patients. You'll find the link in the description and in the pinned comment. Additionally, with the code START, you can access your first month for a symbolic 2 in your local currency.